God.
Adrian.
Sorry.
Thank you.
I don't
So,
know what's going on.
so I think it's the network. It's even better now. Thank
So I
God.
go live and then I added you. Like, hopefully, I hope
Okay.
your people can see.
Yeah.
Okay, okay.
So,
So,
good afternoon, everyone. So, we've been live with Tola Makinde, and we've been discussing Down syndrome. So, before now, we've talked about what Down syndrome is. We've talked about how to identify Down syndrome. She's been walking us through the condition. Earlier we talked about different spectrum. I asked her about different spectrum because I know about autism spectrum, different like the difference between autism and Down syndrome. I think she's able to do justice on that. Now she will still walk us through that for people that were not able to join us the other time. So she will just, summarize everything for us so that all of us can learn and be on the same pace. My name is Oluwatimileyin from Teledoc. What we do in Teledoc is we connect you to a licensed medical doctor or a specialist. So that's what we do in Teledoc. We are just a bridge. And Tola Makinde is one of the consultants on Teledoc app. And if you're watching me from anywhere you're watching me, we are streaming on YouTube, Facebook, and if you're watching me from any part of the world, if you're in Nigeria, if you're in Canada, Tola Makinde is on Teledoc app. If what we talk about today, you need to have one-on-one consultation with her, you can just go on Teledoc app and book a one-on-one session with her. She's available. Just check her calendar and just book one-on-one session with her. And amazing. It's a October is a Down syndrome awareness month. So I think she's kind of wants to do a discount for you. So now is the right time for you to talk to her. So now let's go back to what we have for today. So can you please summarize what we've been discussing since 12 p.m. so that
okay.
others who can learn and follow through. Thank you.
All right. Thank you for having me once again. Sorry, there was a glitch in the network, and then we're
Yeah.
back right now to keep talking about Down syndrome. This month is Down Syndrome Awareness Month, and as we all know, people all over the world living with Down syndrome and their people that support them and their families are celebrating. You asked me a question that at birth, how do doctors know? Do doctors need to check
Right.
every baby at birth? And I was like, I believe so. At birth, every baby should be born, not because they suspect the child has Down syndrome. Like I was talking about the vital signs, like checking the baby's eyes, the baby's hands, if the hands are moving, if the legs are moving or is stiff, if the legs are equal, if everything is perfect. And that's why I believe they say you have a bouncing baby boy or a bouncing baby girl. And that's because there are no issues, there's no need for ICU, the baby was not born pretermly, and it's from checking. They notice all of this, you know, red flags like having a smaller head, circumference, like the heads are smaller, and that's what you call microcephaly. It's very common when you have children with Down syndrome, and that's why I said that every baby should be checked. They want to check, and that's why doctors also would notice the baby's got jaundice from checking the eyes. So we talked about that. We talked about Down syndrome and how it affects them. I started to talk about hypotonia, and that is what is the major hallmark of Down syndrome. So hypotonia simply means low tone muscles, and I try to define Down syndrome in a layman's language as well as the presence of some parts or a whole extra chromosome on chromosome 21. And I also
Mm.
mentioned that you and I have 46 chromosomes. But the extra chromosome is what makes it 47 for people in Down syndrome, and that's what predisposes them to a lot of these medical conditions and then the facial characteristic features we see when it comes
Yeah.
to Down syndrome. I think we talked about all of that was what I've talked about so far.
Yeah, absolutely. Yeah, that's cool. Thank you for that. Thank you for making us understand. And I believe everybody watching us right now can also, catch up what we've been discussing since. So now let's move, to what we have for today. We're talking about five major health check after a Down syndrome diagnosis. So what do we need to check after a baby has been diagnosed with Down syndrome?
All right, there are a lot of things to check, and trust me, it can be quite overwhelming. Why I say it can be quite overwhelming is like you're checking every part of the body, every organ in the body, everything you see physical, externally, and internally. And that's why I say it's a lot and it's quite overwhelming. So I just selected five major checks today. Um, I did not include gastrointestinal issues and I did not include orthopedic issues and, a lot more. Well, I have picked to talk about hearing, vision, thyroid function, function, and growth and development. The five major things to check for. And let me start by talking about growth and development. So that there is what we call the Down syndrome growth chart, and that's very important. Doctors will have to go to start looking at that if they suggest or they suspect that what they are seeing is a case of chromosome trisomy 21, which is also called Down syndrome. So if you look at the growth and development chart, what are the things they're looking for? They're looking for the baby's physical, activity at birth. Is the baby crying? If the baby is not crying, why is the baby not crying? Um, so the baby is not crying because probably there is a condition like a heart condition or something going on, and then sometimes they have to check, and the delay in crying can cause more issues. So looking at that part of is the first is one of the first things they have to look at. So if the baby is born and then we're saying, okay, the baby has Down syndrome, they're going to be saying, okay, check the heart condition, check if the baby is breathing fast, check for this, check. So the growth and development charts is such that you know already the child has Down syndrome. So what do you want to begin to do? You're going to talk about physical therapy, speech therapy, and occupational therapy. Looking
Is
at the
it
growth
right
chart.
that when you check the charts, is it right there that when you're going to do the speech therapy and the rest?
No, no, no. It is because you've already diagnosed Down syndrome. And then
Mhm.
for the growth and development, you have to start thinking in the mind that baby would need physiotherapy, speech therapy, and occupational therapy. Because with Down syndrome, I mentioned earlier, there is a growth chart. The baby is not going to grow like every other child, like in height, in size, because of all the issues that we may begin to identify as we continue our testing. So for growth and development, it's very important because you want to begin to give the baby all the support the baby needs from birth, being that a Down syndrome diagnosis has been identified. So let me quickly move to the second one, which is like a major one, which is like the heart condition. Four out of 4 or 5 out of 10 children with Down syndrome would have a heart condition, and that's about 50% of people with Down syndrome would have a heart condition. There are different types of heart
Sorry,
conditions.
go back on the take. 4 out of 10.
Yes,
Wow.
I said 4 or 5 out of 10. According
Oh,
to research,
wow.
50% of children born with Down syndrome would have a heart condition. So it might be from mild to moderate. Some are self-corrective. Some will be needing surgery. Most definitely, they will need surgery to be able to address the repair the hearts. And there are different types of heart conditions. We have the ASD, um, we have the we have PDA, we have VSD, we have ABSD. So we have the tetralogy of Fallot as well. So all of these heart conditions need to be identified. The doctors need to know which one is this child having, and
Mm.
how is it the one that would, close by itself, especially the PDA. They might say the child has small PDA, might be large PDA. It might be that the hole is in the upper chambers of the heart, or the hole is in the lower chambers of the heart, or the hole is in the walls or the middle of the heart, or the four chambers of the heart has a structural defect. So when you look at the anatomy of someone with Down syndrome, it's quite different, you and I that don't have Down syndrome, like the shape of their head, their arms, the short fingers, the short legs, short limbs, the flat feet, the slanted eyes. Those are all of the features. There are about 50 features, but the most commonest ones you can see are just that the slanted eyes. Sometimes the low set ears, they're a bit lower. Like I said, these are the different features you see, and it just
Physical
makes the
activity.
physical features. Yeah. So we're not even talking internally now. When it comes to internally, it's different, and that takes me to talk about the. So let me say more about the heart condition. What you see rapid breathing, irregular heartbeats. You see, sometimes the doctors will tell you that this condition needs heart repair, needs surgery. If not, the child might begin to have what you call pulmonary hypertension. And then sometimes you see the lips begin to look bluish. You see poor feeding. The child is not able, sucking reflex is poor. The child is not able to breastfeed like it should. And that's because the child gets tired or gets fatigued easily because of the heart condition. So the child is struggling. The heart is working extra hard to breathe, to beat. You can imagine. So that's for the heart condition. Now, let me take us to the thyroid function test. The thyroid is a very small organ. It's very small in the body, but it's mighty. It's what helps to ensure that growth can take place. The thyroid gland has its own work, like part of it's like the part of the one of the major engines of the body that makes it to function normally. And what is common in children with Down syndrome? This particular test can be done at birth, just like the heart condition as well. They will tell you from birth, you need to do like echocardiogram to check what kind of heart disease does the baby have, or maybe the baby does not even have a hole in the heart, which of course is a good thing. So when we talk about the thyroid function test, we want to check if the child has what we call hypothyroidism, and that is an underactive thyroid hormone. And because it's underactive, it predisposes the child to some other health challenges like constipation, the baby gets tired easily, the baby cannot focus, cannot concentrate, metabolism rate is slow. Naturally, that is even slow, especially when it comes to breaking down carbohydrates in children with Down syndrome. Then the thyroid function is also important for the brain and nervous system development. You and I have our thyroid glands, and if it's overactive, it's a problem. If it's not even active, if it's a problem as well. So that makes it imbalanced. So for hypothyroidism, there's what you call the TSH, is thyroid screening hormone test, and then you have the T4. Those are tests that mothers will be advised to carry out for their kids. And apart from the TSH test and the T4 test, we are looking to see how the thyroid is functioning. And if it's not functioning underactive, the child has to be placed on medication. It is as simple as that. If not, there will be excessive gain weight, They're gonna have like dry skin, poor concentration, hyperactivity. It's a lot of things to be going on because the thyroid is an hormone which is not regulating all of these activities like that have to do with energy levels, especially. I think another one I'll talk about is another major one I'll talk about is I picked the five major ones, right? So hearing. Hearing is very, very important. Like you and I, if I don't hear what you say, I will not be able to respond to you. So for expressive and receptive skills in communication, hearing is very important. And if you're not hearing what someone has said, you cannot give a quick response, right? And with hearing, it helps with speech development. So if a child with Down syndrome is not hearing, it delays speech. It's one of the things that will delay speech as well. And there are different types of hearing conditions in Down syndrome. There are some that affect the nerves, the tiny nerves in the bone, the tiny bones, structure in the ears. Like I talked about the anatomy and the structure of people with Down syndrome is quite different. So they have tiny ear passageways. The passageways are tinier than usual. Um, they have sometimes they retain fluid in the ears. Then the ear canals are smaller and a bit more horizontal than normal, and that's why they can retain fluid in their ears. And so with that, with with the retaining fluid in the ears, they are highly predisposed to what you call the glue ear. And glue ear can cause like temporary ear loss. We have the ear infections as well. We have the middle ear infection. We have the um, so sometimes when they have the fluid, if there's fluid in the ears, they have to like have like minimal invasive surgery where they have to insert grommets in the ear. Grommets are like tiny tubes that will
Okay.
drain the fluid. Yeah, and sometimes those grommets just fall off themselves. They will need medical treatments. They will need, and of course, I know that in Nigeria, for children that are trying to do all those early checks that have Down syndrome, like early checks should start from 6 months, apart from the echo early checks should
Yeah.
start from 3 months. So so from birth, not even 3 months from birth for the heart. But for the ears, we are looking at how we can detect ear infections. Sometimes, like there is pus in the ears, ear infections. It's called one of the infections is called otitis media. The other one is called otitis media effusion. With effusion, effusion means there is already like a hearing loss problem going on. And with glue ears, you don't want to joke with that. You try to see the pediatric ENT.
Okay.
It's very important it is pediatric because they need all those their machines that are tinier than normal to be able to check what's going on behind the ears. Then we have different tests we can do as the child continues to grow. We have the auditory, we have the tympanometry test. Auditory will help to identify to know if the child can identify sounds, including speech sounds. And then tympanometry also helps to check the pressures in the ears and if there's fluid in the ears. That's very important because if you are not looking to check with the ENT early enough, you will not know if your child's hearing is
My
100% well.
before you continue, sorry, all these checks you've been talking about, are they all the checks that you need to do at the go at a stretch, or is it at each phases or when you've noticed that okay, like you talk about the growth charts, as okay, they are not doing this, they're not doing that, or you talk about something about the arts, you talk about 4 or 5 out of 10 children, that are having Down syndrome, they have that. Is it everything that they need to do, all these things from top to bottom, or as they keep on seeing the signs and symptoms?
There are tests you need to do. When you have a child with Down syndrome, the news is heartbreaking, right? Um, but there are tests you should start to do, especially the echo. So sometimes the doctors will tell you wait till 3 months, right? Sometimes they tell you they're not really sure about the hole in the heart. At 3 months, it might be more obvious. Then hearing test, eye test, you know, they will tell you already you have to do this test. And I think from 6 months, most of this test should have been done, like should have been started, because there's still a lot more to do. And that was why I mentioned growth and development, like early intervention, you know, helping the child with stimulation, because everything, well, all of the challenges would not come in a day, like come at a go at you like that. But what I'm trying to say is it's quite different when you have a child without Down syndrome. And I also talked, I'm taking us back right now because I'm trying to like make us understand like what hypotonia does is it is in the body, it's in the system, it's the whole mark of having Down syndrome. I'm still going to talk about vision, and I will tell you why um, all these things need to be. It's just for you to, um, you know, catch it early so that you can start treatment for what needs to be treated. Nowadays you keep treating what is treatable. You keep treating what's treatable just to give them a better outcome, like a better chance at life, help them live longer because they're living longer now and they're doing well. And then I was talking about before you chipped in, I think I was talking about the hearing. Like I talked about the shape of the ears for every child with Down syndrome, the shape of the ears, the structures. So it's different. So it's why we need to keep checking these things early enough. For example, your baby is 3 months and then you're noticing there's spots from the ears. You're not going to leave it. You can't leave it. And sometimes this spots or infections can even come from breastfeeding for even children without Down syndrome. Infection of the ears can happen to any child at all. So because you know this child has Down syndrome, you're now, I think my own advice would be the more reason why you should get all those checks like done early enough. From 3 months, 6 months, yes, there's time for you to grieve the baby you were expecting, or maybe you did not expect to have a child with Down syndrome. But all of these tests gives the child a better chance of learning, better chance of doing things when they're ready to do it, because they're gonna have like milestone developmental delays. The doctors will tell you all of this. They will tell you the worst case scenarios. They will tell you your child may not be able to walk um, at the right time, or may not talk, or may not sit, or may not be able. They will just give you the worst case scenarios, which is heartbreaking already. So you not checking all this um, um, is not in the interest of the child. You know, you checking all this gives you um, a kind of like, what can I say? Okay, so let me put it this way. You checking out, doing all this tests even gives you kind of a form of respite that you're doing, at least doing, though it's a bit scary because you don't want to take your child to the cardiologist and they say the child has a hole in the heart. Of course it's going to break you, but it's better so that the child does not develop pulmonary hypertension, which can lead to a heart attack, and the child will just die like that. So I believe every child has a chance at life, has a chance, has a right, to good health care and all of that. So because if the child has been diagnosed with Down syndrome, why should you not go all out to do the checks? Some of these checks are very, they're quite expensive. Yeah, but the thing, sorry.
I said I'm about to talk about that it's expensive.
Don't
So
talk about it.
continue.
Don't go there.
Okay.
That's not this topic at all because
Okay. I
I,
understand.
it's kind of emotional for me because I've seen and taken care of children that eventually died from cardiac arrest, from not getting surgery done on time because of money. I've seen. It's making me emotional right now. I'm not
Yeah,
here
I
to
can see
cry.
that. I can see that. You understand? I
Yeah,
can see
because I've
that.
raised funds for, I mean, we've had 5 projects, trying to just keep them alive because the heart is what pumps the blood. And imagine that, let me give my example. My own daughter had a surgery when she was 8 months old. Immediately after the surgery, she began to sit. She started doing things she couldn't do that she was struggling to do. So if you're not taking care of those things as immediately, the child has no chance. Kind of. It depends, like, especially the heart. So for the ears, sometimes you can say, okay, you will leave this, you will check it later on. But when you realize your child's speech
Mm.
is not coming, like, because speech is the last thing to expect. If you look at the pyramid, for a child to be able to look at you, listen when the name is called, and look at you and smile, is part of speech. It's just an expression. Because if you say something to me and I say something to you back, what we are engaging is we're engaging in communication. So
Mhm.
I'm expressing myself. You are listening to me. You are receptive. You're talking back, and we're conversing. We're communicating, right? But if a child has ear infections and it's affecting hearing, or the child is beginning to have like mild hearing loss, the child is not going to process that information like how you want it. So it is believed, according to research, that children with Down syndrome have a slower processing time. When you say, give me the cup, maybe, anyhow, I don't know, but maybe the child only had cup or is trying to process give. So early intervention is such that, now taking us back to the growth and development, you take the child through speech therapy, physical therapy, occupational therapy, and you take it at the child's pace, just a day at a time. It's quite overwhelming, right? And what you want to ensure is that learning is taking place, understanding is taking place. They understand the concept of what you're trying to say, what they're trying to teach. If you say, put the cup, give mommy the cup, they understand it. Now we're still going to have to teach colors, well, I don't think we're doing teaching today, sorry. Don't let my teacher part come into this. So in essence, what I'm trying to say is, without these checks, you cannot give your child, you cannot expect um, the child to cope as much as you're expecting to see improvements. Like maybe the child has uh, speech delays. I would ask you, have you seen the ENT? Have you checked the child's ears? So with ENT, there are a couple of other things. So ENT, if you go to ENT will tell you if they've noticed large adenoids, which is behind the nose. If they've noticed that, they will tell you. They will tell you if they've noticed anything in the throat, like, okay, it is believed that children with Down syndrome have like a large tongue, their tongue very large. But again, it's it's being contested that it is their jaws, that they have smaller jaws to house the tongue. And then the upper roof, like if you put your tongue up like that, it can actually house our tongue. But for them, it cannot house their tongue.
Mm.
It's shallower, it's narrower, it's smaller. If you get what I mean. Remember, I talked about the shape of the head, and that's
Yes.
so at birth, I say it's smaller. I said it can be smaller at birth, which is called microcephaly. And then the shape is called brachycephaly. In nature, that's what it is. It's You see the flat head, you see the slanted eyes, you see all of that. So imagine you're seeing this. There is a skeleton holding what you're seeing. Like, so that's the anatomy, the shape of what I'm trying to describe to you. That is what Down syndrome predisposes them to. So, and I'm saying to you that the ears have a different structure. It's smaller. So it will build wax easily. It will not be able to drain fluids easily. I think I've spoken a lot about the ears. Let me go to vision.
Yeah. You're still talking about.
Okay. Vision. I'm going to vision
Yeah,
if you
yeah,
want
yeah.
me to.
Yes.
Vision is very tricky. It's very, very tricky. So I remember when my daughter was when she was 8 months old, we were in India for the heart surgery, and immediately the doctor said we should check her eyes. And at birth, I noticed something in her eyes. Uh, she had the eye movement was very, very rapid, very rapid. Like it wasn't even staying, and that is one of the causes. Sorry, that's caused by the low tone muscle. So imagine low tone muscle. The hands are floppy, the body is floppy. For some children with Down syndrome, it's not as floppy. So, like I said before, it's from mild to moderate to severe. Anything I say is from mild to moderate, severe, because it might not affect them the same way. So, if imagine the black people, it was just really all over the place, and that was why, what I'm sure, one of the reasons they had told me to go and get the eyes tested. I'm like, at this age, what would they see? What would they find out? But I knew there was something wrong with the eyes. Like it wasn't even staying. Um, so there are two things to that. That can remain. It's called nystagmus. It's called nystagmus. And then that can remain like that. It can improve over time, but don't be deceived because there is hypotonia. It might be mild. It might still be there. And that is part of what affects the vision. So the child is seeing well. Between you and I, we feel there's nothing wrong with the eyes because they say they are visual learners. They watch TV. They love to watch what you do. They are good copycats. I'm talking about people with Down syndrome as children. They're good copycats. They love to copy what you do, and they're very good at it because they're seeing, so they can see more than they can say. If you get what I mean.
Yeah.
So more that they can say means they're good visual learners, right? Okay. So, but if you put a paper or a book or something like to read in front of them, see that thing I was talking about, like the rapid movements, they are seeing dancing figures.
Oh,
Not, I'm saying so when I say they, I'm saying some. I'm not saying it's. I'm saying it's possible. It's part of what happens to people with Down syndrome. Part of the challenges they cannot even explain. So the figures are not really stable, and that's what you call visual acuity problems that comes with their vision. So they will need glasses, and sometimes with the rapid movement thing, they might have what you call a lazy eye. One of the eyes might look like a bit dull, may not be very strong. So what doctors do is they patch the very strong eye to help strengthen the lazy eye. And we have what we call strabismus as well, and that's crossed eyes. They can have that as well. So you see that as well. Uh, we have blocked tear ducts. So the system is not able to pass through it. Like, the eye washes itself. And that's one miracle we can explain. How the eye just washes itself and drains back. But it's such that they can develop blocked tear ducts that um, the eyes are not able to wash itself. So it comes in as like they're crying, it comes in as tears, just like they're crying. But it's just that the ducts that drain fluids from the eyes that you and I have natural are blocked. Why you need to check the eyes again is because of early onset of cataracts, very common in Down syndrome, you know. And I'm not saying, like I said, I'm not saying every baby, or I'm just saying these are the checks. And as early as you can check it, go ahead and check it. 6 months, go ahead and check it. 1 year, and then yearly checks are very important to catch these things on time. Very important to catch it on time. You see, because without addressing these issues and treating what's treatable, you can't expect much. Like you want your child to read, you want your child to speak, to talk, to develop brain development. You want, all of, because it's gonna happen. It might just be slow. Even
Mm.
this thyroid function test, a thyroid that's untreated would cause all of this. The child will not be able to focus to learn. So what I'm
Before,
saying,
before you
okay,
continue, if you're waking us and you have any question or something is, as the discussion has been going on, you you want to ask Dr. Tola Makinde something, you can just put it in the comments so that we can all see it and she can answer the question. So, and also, I'm just letting you know, so we've talked about it before. If you're seeing us from YouTube, from Facebook, you can book Dr. Uh, Adetola Makinde. She's on Teledoc app. What we just do is that just click on Teledoc app, search for Adetola Makinde. That's the name that is on Teledoc app. Just type Adetola Makinde. So you see her name. When you click it, you see the time that she's available. Just click it and book a one-on-one consultation with her. You can address any issue relating to Down syndrome right from there. She gets to, give you different, uh, um, stages you need to follow, all those guys. She can guide you, prepare maybe like weekly guidance, monthly, or all the rest from Teledoc app. So thank you so much. Please continue, ma'am.
oh,
Sorry.
thank you very much for disclaimer. I'm not a medical doctor, but I'm a
Yeah,
consultant. Mhm.
yes,
And
yes,
yes, I think raising my daughter has exposed me to a lot of connections,
yes,
different parts
yes,
of the world, doctors in the US, UK. I get to talk to doctors. I get to keep relationships with them. I remember when my daughter had a adenotonsillectomy surgery in South Africa, and it was like that at last this thing is we're taking this thing out. But it didn't end there. After adenotonsillectomy, we celebrated 1 year, 2 years, first surgery, and then something else cropped up. And so sometimes, see what I'm saying? Sometimes you've done all you need to do, and then something else crops up. I'm going to read a message here from my friend, Six to Love Twins. I'll read it later. I want everyone to read what she's sharing there. And it's the truth. Um, sometimes you can't just have it easy. Sometimes you have to do what you have to do to have it easy, right? So after we did that, I was still in touch with the doctor, and I realized my daughter had sleepless nights. She was restless sleep, and um, it was becoming a concern for me, um, to the extent that she would stay awake, because I know there are other compensatory ways. There are ways children with Down syndrome compensate for what they cannot do. I have told you about orthopedic issues, and we're not talking
yes,
about that today because that's a lot as well. And there are
yeah.
things we need to look out for so that we don't begin to say, expect, I don't want to say, use the word a miracle. We can expect a miracle. It's okay to expect a miracle. Don't get me wrong. But I'm saying we need to engage in physiotherapy to get some some better outcomes, or I don't want to say best results, but because physiotherapy is not supposed to um, totally change everything. It's just to make it
Mm.
better. Like, you get what I mean? So back to my daughter's story. We did the adenotonsillectomy, and I thought everything was over. But like 2 years ago, yeah, three. I realized she was having this cough and holding, and she was choking and always like, and not sleeping. And I went again to the ENT. We started all over again. We did audiology, we did tympanometry, all those tests. We did. They checked the ears. They would say it's narrow. They would say one ear is dull. They would say this. They would say that. You know. And I remember there was a child that was very hyperactive as well, was a bit restless and with heavy snoring. So the mom would be like, "Oh, my daughter should at least be sleeping, you know." But when she sleeps, she snores heavily and she's restless and blah blah. I said, "Okay, go to ENT." And when they went to ENT, she had large adenoids, very large adenoids. So when you treat what is treatable, you are supposed to see a little bit of improvement. So imagine you don't treat it. Imagine. So back to 2 years ago when that was, back and forth, the coughing thing, the restlessness, we had to go back to surgery. This time around, we did they call it excess removal, I think MLB, excess tissue removal behind the back of our throat, tongue. So people will tell you if you take out adenoids, don't think that is the end. And
Mm.
eh, my I don't know whether I should say this here. We've done that surgery, but there's still no improvement.
Yeah.
In actually, it's still she's still having like restless sleep, but at least that nagging cough, that choking feeling is no more there. So what I'm trying to say is, right, you have to consider the medical aspects, treat everything you need to treat. So you know you've played your part. So you can give the child a chance for a better life. For
Mm.
some of the things, it's not like we know we are not intentionally not wanting to treat them. But there's sometimes we don't even know what's happening again. Like, some of these things don't really go away like that, right? Sometimes when you treat them, you see the improvements. So I feel it's better to keep treating. So what I was saying about vision, to continue from where I stopped, I talked about the blocked tear ducts and I talked about reading. So according to research, children with Down syndrome their strength is in reading, and I just wonder, reading, wow! And then I began
Your
to
strength is
explore it.
in reading.
Reading, yes, I began to explore it, and I saw, yeah, it was it was it was I was inspired because looking at all of these conditions, all of these medical issues, and people thinking, oh, they have a learning disability, they will not be able to do this, they will not be able to do that. Even the doctors will give you the worst case scenarios, but they never talk about the positives. They never look into the abilities. They never look at what's possible. They keep looking at what's not possible. And we're saying if we get this medical checks, you know, um, if we get these medical checks done and we treat what's treatable, we're giving our children the better chances of, reaching their potentials in life. So for the vision, I think I talked about the cross ties and all of that as well. I think what we need sometimes to help them to do is to do regular checks. They will need glasses. Sometimes they will need surgery for cataracts, surgery for the blocked tear ducts, and wearing of glasses. So if you've considered supporting your child in all of those areas, and you're checking the thyroid from time to time, you're doing your yearly checkup, 6 months checkup, you're doing that. The child that needs hearing aids is using hearing aids. The child that needs grommets is using grommets. I think it's going to improve development. It's going to improve development, if you ask me. And that's where we are today. We're still on the journey. There are other medical issues coming up. There are tons of them. I mean, that have been diagnosed. I said coming up, but I'm saying that has been diagnosed. And there are some that go undiagnosed as well. For example, autism. Autism goes undiagnosed in Down syndrome because it's a thin line. It's very difficult to diagnose. So I think I
So,
wanted to read.
so here in the comments, a person wrote, "Six to love twins as a birthday." She's saying that one of my twins had a hole on her heart, but thank God it's closed on its own. She was 8 months, tired, fine. but there are so many medical conditions that affect them. Rheumatoid for one of my girls. So she's saying that the hole in the heart closed on its own.
Yes. I
When
mentioned
it
that
closed,
earlier.
that
I mentioned that earlier that some will close on their
okay.
own, and I mentioned about 50% of people with Down syndrome would have a heart disease,
Yeah,
according
you
to
said
research.
something.
4 or 5 out of 10 would have a heart condition, and some will close on its own. Some will need heart repair. Some will need um, like stents. Some will need devices. Some, it's just what the doctors would conclude to do for the child, depending on what was presented, depending on the presentation.
So today will not be the last day you come in because we still need to bring you live where you can share slides so that many people can learn. This is just Instagram live where it is limited. I mean, this live is limited. You cannot share your slide, you cannot do this and that. So I think we need to bring you where you're able to share slides, show pictures, show videos, so that more people can actually learn and it can be much more engaging. So there's a person here, yet C22. She said, um, "Is pulmonary hypertension reversible in all cases? And what do you think the outcome or something?" I mean, she's talking
Okay.
about the pulmonary hypertension in cases in
Yeah.
Down syndrome cases.
Yes. So if the heart condition needed surgery, or so the way doctors skip the Down syndrome diagnosis, or they miss it and they don't tell the parents, the parents go, probably the child has a heart condition, maybe some will close by itself, um, some will need surgery, but if surgery is not done, different things can happen. They would ask you, is the child turning blue? Does the child's lips go blue? They will ask you all those questions. But we are
Sure.
saying if the child needs heart surgery, corrective heart surgery, it should be done as quickly as possible. If the child grows with it, depending on the type of heart surgery that it is, there are some complex ones like AVSD, the VSD, the tetralogy of Fallot is actually very complicated because that does not even give oxygen to the heart at all. It's low oxygen, and then that is structural defects by itself. So you see, for the heart surgery, they will need to construct maybe other chambers, for the heart. So if you look at the damage or the extent, the at which the type of heart disease has caused the heart, it leads to pulmonary hypertension, um, and that could lead to other infections. Even if you have like a bacteria in the mouth and you have like maybe you need to do a dental checkup. Dental checkup is one of the checkups as well, very important for children. And there is any bacteria in the mouth and it goes in, it can affect the heart, depending on the state of the heart. So, pulmonary hypertension is a 50-50 condition whereby ordinary malaria, if the child has malaria, has other complications, infections, it can lead to a heart failure. Pulmonary hypertension is not reversible. It is only managed using medication which is lifelong for pulmonary hypertension. So we want to avoid having that type of scenario where the child already develops pulmonary hypertension because anything can eventually just cause a heart failure and the child dies.
Sincerely,
But
we
it
are very, very.
can be managed. Like I said, it can be managed.
So, you're saying that pulmonary hypertension can be managed, right?
But it's irreversible. Yeah, that's what I said.
It's irreversible. So, to my final question, I just want to know that from the cases you've seen and you've handled, is all these checks, I know that majority of this check is being done when a child is young, is it applicable to when they've, they've grown to, like, let's say 20 years, 30 years, like that, or is it continues? That's what I'm just trying to know.
These checks are yearly checks.
Okay.
From when the child is born, they are yearly checks. I said it helps us to catch whatever is coming because I've seen children with Down syndrome that have cataracts from age 6, age 3, age 4. So it just helps us to catch whatever is coming
Okay.
because Down
So,
syndrome predisposes them to a lot of medical conditions. We understand that already. So
yeah.
you know that different conditions, they are predisposed to different conditions. What do we do? Do these checkups, try and arrest them, on time. It's part of early intervention.
Thank you so much. Thank you so much for giving us this wonderful insight. For the past, for like more than 1 hour, we've been on this. This session is probably the longest session we've had on a live. Thank you for giving us your time. We will not take it for granted because majority of consultants, they always have one thing to do, so they always try to rush things. But you are here, you break it down to the bits. So we are great. Thank you so much.
You're
So thank you so
welcome.
much. And to our viewers out there, you've heard all what we've been talking since. Tola Makinde, like I've said earlier, she's on Teledoc app. If you need to have one-on-one session with her, you can download Teledoc app. If you're listening, I know you're one of our followers, maybe you are in the US now, you can't reach her, or you are probably where you cannot meet her physically. You can always talk to her virtually, and it will be like you're experiencing it physically. So download Teledoc app, search for her. Sanusi Oreshegun, she's thanking you. Say thank you, ma, and God will continue to strengthen you. Amen. So you can just download Teledoc app, search her Adetola Makinde, and have one-on-one session with her. She gets to do so many things with you and your child. So if you're a parent or guardian, now is the best time to book her. And like I said at the beginning of this live, I said October is Down Syndrome Awareness Month. And she's doing something that most consultants don't do. She's giving out a discount for you to have one-on-one session with her. I can see her passion as she's talking. She's passionate about this, So just have one-on-one session with her, and that is it for today on our live session. Thank you once again, Adetola. Thank you so much. Until the next time, we'll be having you, and we hope that you respond to our call when next you want to, have one thing with you. Thank you so much. And to our viewers at home, we'll see you next time. We'll bring another different topic to you so that we can all learn and share. Thank you so much. Bye.
Thank you very much. Bye, everyone. Thank you, everybody, for joining this session. Good to see you again. Bye. If you have more questions, you can put the questions in my. If you have more questions, you can put the question in my in the comments. I'll be able to answer them. Thank you, Tupe. Thank you, Ayodele. I'll be able to check back to answer your questions. Can you please share this live, share the post, and you can follow me as well so we can do this together. Thank you. I'll wait for everyone to go before I exit. Thank you for joining, Obi Rachel. Thank you. Obiche. Thank you so much, everyone. Okay. Bye.